I'm Catherine Martin from the University of Alberta Faculty of Nursing, and we're going to talk about how to do a central line and PICC line dressing change. In order to prepare for our PICC line dressing change, we need to gather our supplies. We're going to require a sterile dressing tray, Tegaderm dressing, several alcohol swabs, measuring tape, and our blue threaded Luer lock cannula, a mask, pair of sterile gloves and a pair of clean gloves, our StatLock device, some chlorhexidine swabs, and finally our normal saline flushes that are labeled with the patient's name on so that we can check them against their armband, blunt end cannula, and finally our heparin solution, once again in a 10 ml syringe labeled. Now we're ready to begin our dressing change. In order to begin our PICC line dressing change, the first thing we want to do is inform our patient about what we're going to do. Remember to ask the patient not to talk or cough or anything over top of the insertion site while you're changing the dressing. The next thing I want to do is comfortably position the patient's arm on top of a pillow, and in some situations, in some hospital settings such as the Royal Alec Hospital, they want you to use a sterile drape under the arm. For our purposes here today, we're just going to use a blue pad. Now I want to open my sterile dressing tray and add my supplies. I need to add my Tegaderm, my new StatLock device with skin preparation, my chlorhexidine swabs, several alcohol swabs to dissolve the old StatLock device, and finally my blue Luer lock caps. I want to measure from the insertion site to the end of one of the hubs, and I want to measure before I do the dressing change and again at the end of the dressing change to ensure that there hasn't been any migration of the PICC line during the change. At this point, you're going to put a mask on, but for the purposes of this video, so that you can hear me, I'm not going to wear the mask, but this is the stage that you would wear your mask. Now we're going to remove the Tegaderm that's on the dressing, and to remove Tegaderm safely on the patient, we just stabilize our PICC line and then pull from the corners very gently out and around. And that will loosen the Tegaderm off the skin. Now I'm going to take off my clean gloves and put on a pair of sterile gloves. I want to open my packaging and just touching the inner flap that's folded, pull it open and kind of stabilize it so it stays open for you. Now I take my dominant hand and just touch the inside of one glove, lift it up and step back, put my first glove on, only touching the inside. Next, I want to reach up and grab my next glove, lift it away and remove my thumb once my hand goes inside. So we only touch the outside of the second glove. And then I can remove my paper. You want to assess the insertion site for any redness or swelling, bleeding, or any other signs of infection. Now I want to take my alcohol swabs and start to dissolve the old StatLock device. You need to use as many alcohol swabs as it takes to take off the StatLock. So now that I have the stat lock loosened from the alcohol, I need to stabilize it with the piece of tape that comes with your stat lock device. And I want to open the doors that are holding the stat lock. Very carefully remove the old stat lock device. Now we're going to use our chlorhexidine swab to cleanse the area. So we take our first swab and just in a circular motion go around and then turn it over and use the other side and continue in a circular motion from the insertion site outward. Discard your first swab, and then we'll take our second chlorhexidine swab and we'll cleanse down on the line from the insertion site outward. Turn over and do it again. At this point, you need to let the skin dry for about 30 seconds to a minute. Once the area has dried, you need to take the skin prep that comes with your stat lock device, open it up, just remove it from its package, and then gently prep the skin the same way from the insertion site in a circular motion. Discard, and once again, wait for the skin to dry 30 seconds to a minute. After the skin has dried, you're going to take your stat lock device and notice that on the back there's two flaps of paper that will be removed once it's underneath the PICC line. Take the arrows and insert the stat lock device where the arrows are pointing toward the insertion site. Gently slide the stat lock device underneath the PICC line. And fit it inside the prongs. At this point, you can reach underneath on one side and remove the paper backing, and your stat lock device will fit down. And again on the other side, grab the paper, stabilize, remove, and your device will fit down. And finish up by closing the doors on your device. Once the device has been stabilized, you can remove the additional tape from below. Now we're going to finish by putting our Tegaderm on top. So take your piece of Tegaderm, peel off the back, set it over top of your stat lock device, and remove the paper around the outside, gently pushing down the edges as you remove. So I peel off the paper backing around the Tegaderm. And now that the Tegaderm is in place, I no longer have to keep sterile. I need to take the small little piece of paper on the top of the Tegaderm, write on it and date and time my dressing, peel off that piece of paper and attach it to my dressing. Now that I have my Tegaderm in place, I need to do my final measurement. Once again, I need to measure from the insertion site, as I did before I started my dressing, to the end of the same hub to ensure that migration has not occurred. If you're going to be connecting any of your lumens up to an intravenous, just a reminder to use the blue Luer Lock insertion cap between your PICC line and your intravenous line to ensure that they don't come apart. Now we need to document our procedure. So I need to document the dressing type, the change, the type of solution that was used to cleanse the insertion site, how the PICC line was secured, and that we used a sterile technique. I need to talk about measuring and what the distance was from the insertion site to the hub, both before the procedure and following the procedure. And I need to comment on the site assessment. Was there any redness or swelling, odor, drainage, and what the site looked like. I need to make a comment if I've done a swab for CNS as well. Finally, talk about how the patient tolerated the procedure. A few important reminders. Remember, before we use any of the ports, to ensure that we flush. Flush each port daily when it's not in use. And document on your IV record. The first dressing change for any PICC line dressing change or central line dressing change is to be done 24 hours after insertion. Dressing changes are done every 7 days or when necessary. Sooner if there is any drainage or redness or possible signs of infection. Finally, injection caps are changed every 7 days, and that's our PICC line or central line dressing change.